I just sort of cut a small piece, but let's talk about for the arm. You could have opted to do an unload of the tendon. That's also an option. You can also, for the clients who are having medial epicondyle issues, flexor or pronator issues, you could also do the buckle. It's just a little more awkward underneath the arm. Okay, you've got to get them into sort of this very sort of awkward position. So when it's usually the flexor pronator group, I often opt to just do the unload since that's easier to get them into position. Again, I would have sprayed first, because if you're doing these types of tapes, they're going into play. This is not just, you know, to send them home. If they're going home, I'm usually doing a kinesio tape kind of a thing. So what we're gonna do is we're gonna identify, if she claws her fingers, I'll identify flexor. Go ahead, relax. Do it again. I'm locked, good. So typically, again, with the medial epicondyle, they're having pain right through this zone. That's that flexor pronator area. So what we're gonna do is we're gonna cover it. Now I would have identified exactly where, mark my X, and figure out how high up and how far wide I need to go. The issue here is the flexor, we want to actually, to do the unload, we want to come past the attachment. Okay, so we want to anchor up here. So this is going to cross the elbow joint a little bit, but when I go to wrap it and do the light class wrap, I'm not going to cross the elbow. I'm going to leave some peeking out. So again, I kind of measure, I need my anchors. I usually put my frayed edges on the inside. Now, this is going to be a smaller version of your unload. Look how small the area is. So this is when we can just use some smaller pieces. Okay, so we're gonna lay it down, pinch, pick it up, lay it down. %50 overlap on the one below, getting that nice basket weave. Now I'm getting closer to crossing the joint line. We're just gonna go right over it. A few more pieces. These seem to be about the right size for what I'm doing. Pinch, pull, lift. I'm almost there. I think this should do it. Okay, so now cover the top, anchor, re-anchor the sides to hold all the strips in place. Okay, so then she'll sit up, swing up. Now we have to use pre-wrap because I have so much skin exposed, okay? So again, kind of stick, yep. I'm not gonna use a lot because I'm gonna cross her elbow joint and I don't wanna do that. Right into me. Just I'm gonna finish right here. Okay, now I would have sprayed, so I'm not concerned that this is gonna get a little bit loose. Because most athletes are not gonna let you cross their elbow joint, especially if they're playing like an overhead sport. So you just try to get as close to that as you possibly can, and just make sure you had a really good spray, that's not gonna come up during the event. Okay? So 2 ways to do it. I could have easily done the unload on the lateral aspect, but I really like that dispersive option for lateral, and I like more of the flexor pronator to get that muscle unload. Okay, so they're both unloads, they're just 2 different kinds. Okay, so why don't we break up